We begin with the Omicron surge, though, in South Korea. New daily COVID-19 infections in the country hit an all-time high of close to 400,000 just a couple of days ago. Now, Monday's tally isn't expected to be quite that high, but it'll still be in the 300,000 range as Omicron spreads at a blistering pace.
Despite the ongoing surge, South Korea has been steadily easing its restrictions, and several changes to its prevention scheme, including virus screening, come into force today. For more, we have our reporter Han Seong-woo here in the studio with us. Good morning, Seong-woo.
Good morning. Happy to be here.
Thank you for joining us. So, how are things looking for today?
Well, so Mokyeon, it's likely we'll be seeing 3 consecutive days in the 300,000 range. We'll know for sure when the official numbers come out, but that is the prediction. Because of the Omicron surge, perhaps between 310 and 320,000 cases, actually. Through 9 p.m. Korea time Sunday, health authorities recorded 301,544 new cases nationwide, down nearly 36,000 compared to the same time on Saturday, but 1.5 times as many compared to the same time the previous Sunday, and well more than twice the amount seen just 2 weeks ago. Health authorities predict the Omicron surge will reach its peak sometime before March 22nd, possibly even this week. Along with the rapid rise in cases comes an increase in the number of severely ill patients and fatalities. Government data reveals that the two tallies last week each saw a 1.4 and 1.5 times increase compared to the week before it. The virus-related deaths were 1,348 lives last week, 2.5 times as many as between February 20th and the 26th.
Now, Seong-woo, to focus healthcare workers' time on those that need the most help in regards to recovering from COVID-19, we hear that the government is changing the way in which COVID-19 or potential COVID-19 patients are going to be screened.
That's right, Mark. To free up resources for testing, from this moment forward, starting today, rapid antigen test results conducted by medical professionals at local hospitals or clinics will be accepted for official purposes. That means the results will have the same validity as PCR tests in confirming COVID-19 infections, relieving citizens who test positive via rapid antigen tests of the need to stop by a screening center and wait long lines to get PCR tested. The decision comes as data showed almost 95% of people who tested positive through a rapid antigen test tested positive with a PCR test as well. The change will allow those over 60 to be prescribed with the oral COVID-19 treatment, Paxlovid, just with proof of a positive rapid antigen test.
Now, Seong-woo, regarding students at school, we heard that they will be able to go to class even though a family member is infected with COVID-19.
That's true. Students and teachers at school who live with someone who has COVID-19 will be able to go to school starting today. Instead of entering self-isolation, they're advised to receive PCR tests within 3 days of their family member testing positive, before taking a rapid antigen test on the 6th or 7th day. Let me also mention that also on Monday, today, health authorities will announce specific vaccine plans for children aged 5 to 11. The Ministry of Food and Drug Safety last month approved the use of Pfizer's vaccine for the age group at a dosage level that's 1/3 the amount given to adults. Health officials say they're going to start with minors at high risk, such as those with weak immune systems. The Korea Disease Control and Prevention Agency says they took into account studies confirming the vaccine's effectiveness in preventing infection and serious illness even among young children. The development comes amid a rise in positive tests among children.
All right, Seong-woo, thank you so much for your report today. We will talk to you again tomorrow.
Thank you.